All right. Well, welcome everyone to our On the Pulse series. I am Chris Fortman, the CEO at the Minneapolis Heart Institute Foundation, and I am so glad that you all made time to join us. Just a little background before we get started on the Minneapolis Heart Institute Foundation. We are a separate independent nonprofit organization, so separate from the Allina Health System, separate from the Minneapolis Heart Institute. This visual kind of gives you an idea that our mission is to improve cardiovascular health through innovative research and education. You can see those in the top circles, and with the result being improving clinical practice with the dissemination of those research findings. So we have been in existence for just over 41 years doing this good work. So what is this work in research and education? We have over 200 active studies touching over 2,000 patients, and half of those studies fall into industry-sponsored clinical trials, allowing medical devices into the clinic to help our patients, and the other half, those studies are physician-initiated research. So the most important pressing questions that our physicians feel need to be answered, we have the resources to support that research. Education is a critical part. We have a paid internship program with over 200 alums here at the foundation. Most of those alumni are currently practicing physicians or in medical school. And during the summer, while those students spend their time with us, they are doing real research with our physician mentors and our research staff mentors, and many end up being authors on manuscripts and presenting at national conferences. Also in education, we provide a CME and community education and publish over 200 peer-reviewed manuscripts annually. So in MHIF current updates, some exciting news. Our very own Dr. Paul Saraja presented a much anticipated late-breaking clinical trial at this year's ACC, the American College of Cardiology conference. This trial, called Triluminate Pivotal Trial, showed that transcatheter edge-to-edge repair using the TriClip system is safe and effective in patients with symptomatic severe tricuspid regurgitation. The intervention reduced the severity of regurgitation and was also very safe, with a low rate of major adverse events around the time of the procedure. To quote Dr. Paul Saraja, he said, "We feel these results are very meaningful for a highly symptomatic population whose quality of life is impacted by tricuspid regurgitation. And with the excellent benefit to risk profile of the system, we feel that a historically untreated population will now have a treatment option to improve their quality of life." This groundbreaking research was published in the New England Journal of Medicine as a manuscript and was even picked up by news organizations like the New York Times. And as I mentioned earlier, the Minneapolis Heart Institute Foundation is a 501c3 independent nonprofit that relies on philanthropic investments that come from community leaders like you. So I want to take a moment to say we are grateful for all of you who make this work possible. Thank you so much. So it is my honor to introduce Dr. Joe Jensen, who is a third-year cardiology fellow who splits time at the Allina Health Minneapolis Heart Institute and Hennepin Healthcare System. Dr. Jensen served as chief resident at Abbott Northwestern Hospital after studying medicine at the University of Minnesota Medical School, where he earned his MD. Dr. Jensen received his undergraduate degree in science business from the University of Notre Dame. And with that, thank you very much. And here is Dr. Jensen presenting on wearable medical devices.
Thank you for the introduction. As I near the end of my training, I've reflected on exactly what brought me to where I am today. Guidelines, as you see here, are the bedrock of medicine and were my partners throughout all 12 years of training since college. These important documents are endorsed by important societies such as the American College of Cardiology and the American Diabetes Association, and these are important practice-shaping tools that aim to standardize optimal care. The most recent hypertension guidelines are here on the left, and the most recent diabetes guidelines are here on the right. I noticed now more than ever before, specific phrases keep popping up: optimal lifestyle habits, lifestyle behavior change, and non-pharmacological therapy. These squishy topics were really never covered in medical school and only rarely discussed in residency and beyond. There's hardly enough time for these bulky evidence-based guidelines, much less these far less scientific topics. In my search to uncover what exactly these phrases mean, I came across Life's Essential 8 by the American Heart Association. These are what they identify as key measures to a healthy lifestyle. They include no smoking, better sleep, good diet, moving more, managing blood sugar, managing weight, decreasing cholesterol, and managing blood pressure. I do find it ironic that we as cardiologists, primary care doctors, endocrinologists, nephrologists, advanced practice providers don't have the training to understand these simple yet complex topics for ourselves, much less having the time to cover these with our patients. To sum this up as simply as possible, we are not good at this, nor do we have the time. So who could possibly step in to address these essential 8 measures that impact literally everyone alive? Industry. No way a target market this lucrative could be passed up. It turns out that at this time, 1 out of 5 Americans own some sort of smart wearable. The market is already large at $14.6 billion in 2019 and is expected to grow exponentially by the year 2025, reaching an estimated $70 billion in a matter of 5 years. It is our job as care providers to understand what's out there, what it means, and start to think about how we integrate this data into our practice and into our own lives. So using the Essential 8 as a framework, I'll give a brief introduction and overview to some of the most commonly and less commonly devices used on the market today. It turns out that these seemingly simple devices are actually backed by both basic science and outcomes data. So without further ado, let's get started. Each section will start with the Essential 8 infographic, and here we see moving more, recommending 150 minutes of activity per week, and some generic tips for success. So why do we care about moving more? Well, it turns out that physical activity is inversely related to cardiovascular outcomes. Let's take a look at the data. And I'm going to give a brief overview. There's a reference section at the end for those that are willing to dig a little bit deeper into the primary data, and there are a lot more resources out there as well. So this first study that I'll look at is a meta-analysis, which means it's a combination of a bunch of different studies. Turns out in this case, it's 48. And this looked at 2.6 million patients over a 2-year follow-up at minimum. And they looked at a specific activity recommendation, which was 750 MET-mins. And for those that are not familiar, which should be most people, I wasn't either, a MET-min of 1 is at rest. If you're running 6 miles an hour, which is a really good pace, that equals 10 METs or metabolic equivalents. And so you would need to run 75 minutes a week to reach that goal. If you were a little bit slower, but still a fast walk of 4 miles an hour, that's 5 METs. You'd need 150 minutes a week. And finally, at a good, slow, sustainable pace, 2 miles an hour, that corresponds to 2.5 METs and 300 minutes per week. Well, it turns out here is the baseline recommended activity level of 750 MET-mins per week. And the more minutes you had above that, the lower your cardiovascular disease mortality would be. More activity, less death. Conversely, less activity leads to a higher risk of death. So why is this? And it turns out there are a couple of reasons for it. And the first is heart rate. And this study, again, was looking at resting heart rate at a metric of 70 beats per minute. If your resting heart rate when you wake up in the morning after sleeping is below 70, your relative risk for coronary artery disease goes down. If your resting heart rate is above 70, your risk for coronary disease or heart attacks goes up. Same thing here. We're looking at non-cardiovascular diseases with a higher heart rate at rest comes a higher risk for these conditions. This is another study that looked at a specific medication, but was stratified again into different outcomes. This is cardiovascular disease death, heart failure admission, a heart attack, and needing a stent for a heart attack. This blue line is people with heart rate less than 70. This green line is people with heart rate greater than 70. And you see that this green line is above the blue line, meaning that there's an increased risk for all of these things: cardiovascular death, hospitalization for heart failure, heart attack risk, and needing a stent. All of those risks are higher with a heart rate greater than 70. The other metric that's important that leads to this inverse correlation is heart rate variability. And to explain this as easily as possible, we have two types of nervous systems in our body, the parasympathetic and the sympathetic system. Parasympathetic, you can think rest and digest. Sympathetic system, you can think fight and flight. And these two systems have different impacts on all of the organ systems in our body, depending on the situation. Heart rate variability and specifically is the physiologic variation in the duration of intervals between sinus beats. That just means, despite us thinking that every heartbeat is incredibly steady, there's actually a little bit of variability between beats, and variability in this case is good, as we'll talk about a little bit. So first, let's do a quick physiology experiment, and everybody can do this at home. And what I want you to do is find your pulse, and you can either find your pulse here on your neck or here on your wrist. The carotid and radial arteries are the two there. And so I'll give you a second to find your pulse. And now that you found your pulse, I want you to take a deep breath in. And then a deep breath out. Anybody notice anything? Now, if you're on a medication for your heart rate, this might not work entirely, but what happens is when you inhale, your diaphragm contracts, the pressure lowers in your intrathoracic cavity, pressure lowers in your heart, more blood returns to your heart, it gets a little bit bigger, and then it triggers these baroreceptors and it suppresses the vagal tone, which is the parasympathetic system, and your heart rate actually increases. When you breathe out, your diaphragm relaxes, your chest cavity decreases. The opposite happens. No longer you're suppressing that vagal tone, and vagal corresponds to the parasympathetic or rest and digest system, and your heart rate decreases. So when you took a breath in, you can try it again. Your heart rate increases, and then when you breathe out, you'll notice that your heart rate decreases. Physiology in action. I couldn't resist. Higher HRV or heart rate variability means higher parasympathetic input, increased variability, and this increased heart rate variability actually has been shown in all of the studies here to lead to better outcomes. And it turns out this metric is not just for the sick, in that people that are well, in fact, elite athletes, it's been shown that daily recordings of HRV are superior at increasing fitness and exercise performance than training based on conventional methods. If you have a high heart rate variability, that means you've got great recovery, you're ready for a hard training day. If you have low heart rate variability, maybe take a rest day, maybe take a little bit easier time on your training schedule. So all of these together, essentially, it turns out that increased heart rate or decreased heart rate variability have really negative effects on our cardiovascular system and beyond. But the good news is increasing activity levels can lead to lower resting heart rate and higher heart rate variability, both good things that lead to better cardiovascular disease outcomes. So here are some of the tools that we've used over the years to measure these two metrics. Starting back in 1760, in fact, was the first pedometer. The first electrocardiogram, EKG, ECG, was in 1895. The first simple pulse oximeter that we use frequently in clinic and in the hospital was invented in 1935. But in 1965, this was a really important invention. The MEMS device, which is the microelectrical mechanical system that can really make all of these sensors that we know today extremely small. Fast forward to 2009 when Fitbit releases its first product, and then just under 10 years later, Apple Watch releasing the first EKG-enabled smart device. Plenty more in the pipeline for the future. This is a zoomed in view of those times between 2011 and 2015 when there was just an absolute explosion of devices on the market that some of you may recognize some of these from Fitbit, Jawbone, Samsung, LG, Motorola. Everybody was getting in the game. One in particular means a lot to me. This is the Fitbit Flex from 2013. And in 2014, when my wife and I were married, I was stubborn and said, hey, I want to keep monitoring my data. I'm going to wear this on the wedding day. Who knew that 9 years later, I'd be referring to this picture in this talk? So how do these devices work? Well, there's a lot of science behind these, as you might expect, but the topics themselves are actually quite simple. This is a triaxial accelerometer, and this is a gyroscope. And these two devices work together to form the 6 degrees of freedom, figuring out exactly how you're moving, up, down, back, forward, left, right, yaw and pitch, yaw, pitch, and roll. The 6 degrees of freedom. Combining this with GPS, you can actually pinpoint the accuracy to 4.9 meters, way out in space with 3 to 4 satellites. Putting all of that data together, these devices are able to collect the data continuously, put it in an algorithm, and then actually train the device to understand what's sleeping, what's working. All of this has been done over many, many years by many smart people in many different situations to get to the devices that we know today. So in order to measure heart rate, there are a few ways to do it. One is pulse oximetry, and that's just a ratio of red to infrared light. We're not going to go too much into that. The other one is photoplethysmography. That's the last time I'll be saying that. And that's an optical technique that detects blood volume changes in the microvascular bed. And basically all devices use this technique. And it's an important distinction from the ECG, which only a couple devices at this point use, the Apple Watch and the AliveCore. So it's really important in medicine, especially when we're coming up with diagnostic or management devices, to compare these new devices to the gold standard. So you can see here the Apple Watch, the Whoop, and the Oura, all of which I'll talk about, were compared to the gold standard EKG, looking at heart rate specifically. And you can see all of these devices actually perform quite well in what they record for heart rate versus what the gold standard ECG or EKG confirms. This slide is just to show that all of these devices listed here are actually very active in the medical literature. For instance, Fitbit has 612 studies in PubMed, which is a large research database, 530 clinical trials, and 40 specific cardiovascular clinical trials. These numbers are changing literally by the day. So there's going to be an explosion of research in the next few years. I want to quickly touch on the foundation or the bedrock of smart devices thus far. This is an article from the New England Journal of Medicine that looked at 420,000 patients that were wearing an Apple Watch over an 8-month period of time. And the punchline here, and I'll leave this here for you to look up if you want to further, is that the Apple Watch was actually a really effective way to track whether patients had atrial fibrillation. And there was a positive predictive value for atrial fibrillation based on the Apple Watch notification in 84% of patients. That's a really good positive predictive value. If the Apple Watch tells you you have AFib, there are exceptions. This was subsequently confirmed by ECG. So looking at what's available on the market today, very briefly, everybody's familiar with the Apple Watch. There are, of course, a number of different companies producing smartwatches, and I've chosen to feature the Apple Watch here because I do have experience with it. They're relatively expensive, and the beauty of the Apple Watch is that there are hundreds and thousands of apps that you can use to track a variety of different things. This is an example of how the ECG works, which is really clever and kind of beyond the scope of the talk, but one of the leads is on the backside of the watch face, and the other lead to connect to your right side or left side, depending on where you wear your watch, is actually the crown, which forms an electrical connection between the left side and the right side of your body to form this single lead ECG. All of this data can go together in their proprietary health app. So it's really cool how you have all of your data in one place. The other big company that's worth mentioning is Fitbit in the activity monitors, near and dear to my heart from our wedding back in the day. And the pricing model is a little bit different here, where you can actually buy the device itself, but then choose an annual or monthly membership to go along with it. The other thing to point out here is there are specific devices for kids, which I think is a great way to enforce the importance of physical activity at a young age in a fun way. Switching gears to Whoop, I really want you to pay attention to the design of their marketing materials. These are all taken from the website. Their mission, which in this case is to unlock human performance, and what it looks like. It's a band that you can wear continuously on your wrist. And it's pretty unique in the fact that the charger actually plugs over the top. And so you can charge the device while wearing the device for truly continuous monitoring. There are 3 main components that all of these devices look at. And in Whoop's case, they call it strain, which is a measure of your activity, sleep, which is self-explanatory, including the different stages of sleep, and recovery. And recovery is a combination. Every company has their own specific algorithm that looks at your resting heart rate variability, and puts it all into a recovery, which then feeds back and gives you recommendations as to how active you should be that day. This kind of comes into the elite athlete category where it really dials in the strain and the recovery that feed back on each other to recommend and guide specific training plans. Whoop came to notoriety back in June of 2020 with the PGA Tour. And this is just kind of an interesting sidebar story in that when sports were coming back after a period of time during COVID, there were specific testing protocols that these athletes had to go through. And for those not familiar with professional golf, the tournament happens Thursday through Sunday, and practice rounds happen Monday through Wednesday. There were strict testing protocols Monday, Tuesday, Wednesday when the PGA Tour restarted. And this is a player, Nick Watney, who actually passed with negative COVID tests Monday, Tuesday, Wednesday. This was a very isolated event. No crowds were involved. And so subsequently, Thursday, Friday, Saturday, Sunday, testing was not required. However, Nick was wearing his Whoop, and it turns out he woke up Thursday morning, I believe, it was Thursday or Friday morning, with a higher respiratory rate than usual. It was 2 breaths per minute higher than what his data had been rock solid over the last 6 months. And he said, something's wrong. I don't feel anything else, but this is not normal. And he reached out to the PGA and said, hey, I think I should be tested again. They said, well, it's probably not necessary. We've gone through our protocols. It's okay. And he insisted. And it turns out he tested positive for COVID. And the first sign was his respiratory rate increasing. That relationship quickly took off between the PGA Tour and Whoop. And fast forward 1 year later, when crowds were allowed back at events again. And here we see Rory McIlroy on the 18th tee of the Wells Fargo Championship, up 2 strokes on the 18th hole, live broadcasting his heart rate during this entire golf hole.
Uh-oh.
125 beats per minute during the tee shot.
Should stay up there. It's long. Oh, it hasn't. Terrible kick. Well, I was meant to side of 45 degrees, so my
up to nearly 140. And Rory is clearly an elite athlete.
You can't do is miss it left.
His second shot, heart rate still above 115 as he's chasing a championship.
Just come out beautifully, just right of the flag.
Yeah, he's giving it a full rip. There you go.
Up to 130.
Yeah.
That is a golf shot.
Great shot there by Rory. And finally, the putt to finish it. Wins the tournament, and his heart rate 130 the entire time. Pretty amazing. So bringing it back to medicine, this is a typical graph that you can see from Whoop, tracking heart rate over a period of time. And this was labeled as activity. So this is what you would typically see after a workout. And this would probably be an interval training workout where your heart rate gets up to 150, then drops, between 125 and 100, up, drops. You can see the trend here. There's about an hour-long period of time. The interesting part about this is this wasn't a workout at all. This was actually a senior resident up in the intensive care unit, actively resuscitating a patient who was really, really sick. And this resident wasn't actually doing chest compressions or anything physical. This was just the strain that was put on his body, reflected in his heart rate for taking care of a really sick patient. So it's not just professional athletes that experience strain, it's even us as medical providers in intense situations like the ICU each and every day. With Whoop, it's a monthly membership model. So you can see that here, ranging from $20 to $30 per month based on how much time you're willing to commit to that membership. Moving on to Oura. Again, you'll notice the differences in the colors, differences of the words, compared to Whoop and compared to Apple Watch. And so at Oura, we know that you are the source of your truth. Health starts from understanding you, and great health starts with good sleep. And Oura was initially really focused on tracking sleep, and they do that very well. And so you'll see the different colors here, but essentially talking about the same things. Oura is a ring that you can wear on any finger, but it's actually designed to most effectively work on the index finger because that's where you can most accurately track a pulse, which is really important for all of these metrics. And so sleep tracking, now they've actually improved their algorithms and the technology to be able to track workouts and activity really, really well in addition to sleep. And then, of course, in this case, instead of a recovery index, this is a readiness score that combines the previous day's activity levels, sleep, looking at the heart rate and heart rate variability when you wake up to give you a readiness score and recommendations as to how you should spend your day. So when you order a device online, a sizing kit comes in the mail, so you can try different sizes on different fingers and then ultimately decide what you want to order. So this is a $350 device with a $6 per month subscription. Cardia is the longest lived ECG device on the market that people can use in the home. And I think this is the one that we as physicians are most, especially cardiologists, are most familiar with in advising for our patients. And this is a device that's grown from this kind of 4-finger device down here now to as thin as a credit card with 2 leads. So making sure that your left and the right parts of your body are detected to produce this single lead ECG. And so it can detect atrial fibrillation, a slow heart rate, fast heart rate, normal heart rate, premature ventricle beats, premature atrial or the top part of your heart beats, and a wide QRS. So it detects 6 of the most common arrhythmias, is what their marketing says. And looking at Cardiac Care Plus, in addition to paying for the device, you can get extra attention, essentially, based on other things you'd like to pay for. This device in particular, their new 6-lead device, is a really clever way to produce a more detailed ECG that we typically look at in medicine, using the same device with an extra lead on the bottom of the device that brings the legs into it, that allows for a more detailed look at what's actually going on with your heart rhythm. That can be yours for $130. Now, there have been a few, this is one of the few early papers that have come out comparing the devices. The punchline here is looking at 201 consecutive patients. Atrial fibrillation was present in 32%, and the Apple Watch actually had the highest sensitivity and specificity, or you can think about that as accuracy, compared to the Samsung, Withings, Fitbit, and even AliveCor, which I was surprised by. So at the end of the day, we've learned that decreased physical activity increases heart rate, decreases heart rate variability, and leads to increased mortality. Now, I'm hoping that with these 3 devices and others on the market, looking at data over the long term, we're going to actually be able to use these devices and your individual data to come up with better risk prediction models than what we currently have. I really want to dial it in to the individual patient in their individual lives and give people the best overall prediction of risk that we possibly can. So moving on to sleep, why we care about sleep, the American Heart Association and their Essential 8 gives some effective tips for success, mainly around the electronic devices that we use on a daily basis. And it turns out that inconsistent sleep patterns have been identified as a novel cardiovascular disease risk factor. Bad sleep, bad outcomes. And one of the things that's very common and a medical condition is obstructive sleep apnea. I'm not going to go through all of these things, but it's simple to say that obstructive sleep apnea leads to bad outcomes for a variety of reasons. 2.4 increased risk in mortality and a higher cardiovascular disease incidence in one study. 50% of obstructive sleep apnea patients have hypertension, and 30% of people with hypertension will actually have obstructive sleep apnea. So one of the public service announcements that I can give is that if you have hypertension or high blood pressure and you haven't been tested with a sleep study, would highly recommend talking to your primary doctor or your cardiologist about getting a sleep study. We can't treat what we don't know about. And it turns out that people with atrial fibrillation especially have a higher risk of sleep apnea, and vice versa. Sleep apnea patients have a higher risk of atrial fibrillation. But what about people that don't have sleep apnea? Well, it turns out that sleep is still really important. And here you have a graph of a really good sleep pattern, which is the duration of sleep in these green bars, the onset of sleep. Consistency and of timing and duration is key. Whereas on the bottom here, you have irregular sleep starting times, ending times, different sleep duration. And it turns out that any of these markers, either the duration of sleep, how long you're sleeping, or your inconsistency of sleep patterns, if you're sleeping less or you're sleeping inconsistently, you have a higher risk for cardiovascular disease. So all of these devices that I've talked about so far track sleep, and they track it really well. Time of sleep, sleep stages, restlessness, heart rate variability, and respirations, as we've talked about. And all of these devices, again, were tested against the gold standard in a sleep study, making sure that they correlate well. And the Apple Watch, Oura, and Whoop can be seen here respectively. Oura and Whoop outperforming the Apple Watch a little bit. In addition to wearable technology, there's actually non-wearable technology coming out from companies. Sleep Number is one of them, where without any sort of wearable whatsoever, the technology is built into the bed, coming up with your heart rate, your respiratory rate, your heart rate variability, and importantly, how much time you're sleeping. They now have 10 billion hours of sleep data from 1.8 billion sleep sessions. And specific beds actually adjust effortlessly throughout the night, depending on if you're tossing or turning. And Sleep Number claims that their users get 28 more minutes of restful sleep per night, or 170 hours per year. And that's pretty significant. They have a collaboration with Mayo Clinic and are currently completing a number of studies. So bringing it close to home, this is actually my 2022 year in review with Sleep Number. And we purchased this bed back in the summer of 2022. So you can see my sleep duration, how much restful sleep I'm getting, my heart rate, and my respiratory rate. And I got 147 nights in my smart bed this year with 1,133 restful sleep. So that's where the good news ends, in that I only had 78 nights of those 147 where I met my sleep goal. I only had 100 of the 147 where I got enough restful sleep. And unfortunately, only 24 nights did I meet my ideal schedule. So I'm hoping that this gets better once I finish my training, but time will tell. Sleep Number actually has a wide variety of price points with access to this smart data, starting with a $1,600 king bed all the way up to a $13,000 climate-controlled smart bed, which I think overall is pretty reasonable. There are other companies in sleep that have similar technology built into a device that actually cools the sleeping environment. And this is a hot area, so to speak, in sleep temperature, because studies have shown that keeping skin temperature within tight range actually enhances deep sleep, improving both the heart rate and the heart rate variability. Interestingly, 8 Sleep used their device in combination with Oura to track whether or not patients were sleeping better with a better sleeping environment. And it turns out that over the month, using Oura and 8 Sleep, deep sleep increased by 10%, heart rate variability decreased by 6%, and heart rate decreased by 1%. Both of those markers, all 3 of those markers, lead to better cardiovascular disease outcomes. So for 8 Sleep, the King cover costs $2,500, which is pretty expensive. And they also offer full mattress setups for $3,700. Moving on to metabolism and healthy diet choices. Again, the Essential 8 has some basic recommendations here. And it's important to acknowledge that the American Heart Association has released a statement about obesity and cardiovascular disease. Excess adiposity promotes changes in cardiac function. Number 1, directly through the effects on the myocardium and vasculature. And 2, indirectly through obesity-related comorbidities. Again, pretty complex physiologic and pathophysiologic pathways here, but you'll have to take my word for it. The good news is that lifestyle modification with associated weight loss improves the diagnostic components of metabolic syndrome and the associated pathophysiologic abnormalities, such as inflammation and endothelial dysfunction. And it turns out that any sort of solution to this really complex problem of obesity would lead to a significant financial opportunity, not just for industry, but for our country as a whole. One of the devices that's really effective in at least measuring and tracking weight are smart scales. You can get pretty affordable scales these days for $80 that tracks not just your weight, but body fat, water content, and things like that. This is the scale that I have at home. There is a new device developed by a company called Lumen that is the first device to actually hack your metabolism. So what does hacking your metabolism mean? Well, it turns out that within this really small handheld device, there's a flow sensor, a carbon dioxide sensor, some circuitry, a battery, and a Bluetooth device that actually allows you to track your respiratory exchange ratio. And that ratio is the amount of carbon dioxide exhaled with the amount of oxygen that your body is consuming. And so based on that ratio, if the ratio is 1, meaning carbon dioxide exhaled and oxygen utilized is 1, that means you're burning carbohydrates predominantly. On the other hand, if the ratio is less than 1, meaning your oxygen consumption is higher than the exhaled carbon dioxide, that means you're burning fat. In between, it's protein and a combination of all three. So a high CO2 means carbohydrate burn, anything above 1. A low CO2 means fat burning. And so this was actually the old way of measuring the respiratory exchange ratio and is the gold standard for comparison. And it turns out that Lumen, a device that you can hold in your hand, correlates really well with the percentage of CO2 exhaled with the respiratory exchange ratio based on that gold standard measurement. And so what Lumen aims for is metabolic flexibility, which leads to natural weight loss, less snacking, energy and mood boost, improved overall health, and enhanced weight maintenance. And the beauty of this is not only does it measure your respiratory exchange ratio, but it gives you daily advice as to how your diet should be shaped that day based on your own individual respiratory exchange ratio, whether that's a high carb day, a low carb day, or any other different ways to adjust your eating schedule to come up with a more flexible metabolism. And this device is billed on a yearly basis, $300 a year, and you can actually get extra benefits if you pay more, and is actually used quite a bit now already in weight loss and weight management clinics. So the last of the 8 that I'm going to talk about today due to time constraints is understanding cholesterol and lowering cholesterol. And part of that is actually taking medication if needed as directed. And it turns out that's not as easy as it seems, in that medication non-adherence contributes yearly to approximately 125,000 preventable deaths. So this is a real problem that has been documented over many years in the medical literature. 50% of cardiovascular disease patients consistently take their medications. 1 out of 2 patients do not take their medications as prescribed. The prevalence of the problem is difficult to assess because we don't really have good ways to track this data. And it's a really complex problem. And because it's a really complex problem, we can't track it very well. It's an undermanaged problem. And there was a recent trial called the ischemia trial. That was a really important trial in cardiology to determine whether medical management versus invasive management with stents is actually better for patients. And it's tricky when one of the arms or one of the control arms is just medical therapy, but 25% of those patients taking the medical therapy reported non-adherence. And that was a self-reporting mechanism. So you have to wonder that maybe even up to 50% of patients, as previously reported in the literature, weren't taking their medications appropriately. So because this is a really important problem, there are specific reviews in the literature that talk about improving medication adherence in cardiometabolic disease. And there are a number of factors that affect medication adherence: socioeconomic, healthcare system related, if people have multiple illnesses, side effects from the medications, and other patient-related factors. And so in this state-of-the-art review, they recommended specific ways to reduce non-adherence. Number 1, identify monitoring methods. If we don't know the scope of the problem, we can't address it. Improve the evidence base to better understand adherence, develop patient and health provider team-based engagement strategies, and alleviate health disparities. So enter Dose Health. Dose Health is a medication management and adherence platform that not only tracks medication adherence, but improves medication adherence. And full disclosure, I'm a co-founder, equity holder, and current board member of Dose Health. And so rather than telling you about how the device works, I'd like to show you instead.
Introducing Dose Health. We have created a smart pill box that deeply integrates with intelligent software, making it a powerful adherence tool. After a brief setup, the device knows which medications and what times they need to be taken. When it is time, the device's internal tray rotates to reveal the correct pills. An alarm will sound to let the patient know it is time to take their meds. If a patient is late in taking their pills, text and email alerts can be set up to notify a caregiver. taking the pills is as simple as turning the device over. And when the device is empty, a simple guide will walk you through filling the easily removable tray. Dose Health also provides crucial tracking data to help facilities and home care institutions improve the care they give. All of this in a small, affordable package. Dose Health, because every dose matters.
So we've made a lot of progress over the years and have 3.6 million tracked dispenses, only 150,000 misses, and that's a 96% adherence rate, far above that 50% that's been observed in the literature. We are approved with Medicaid waiver service programs in the states you can see below, have over 4,000 clients, 6,500 devices, and partner with a variety of organizations in the state and hopefully later throughout the country. And this is a device that costs $60 per month, and that includes 2 of these dose flips, depending on how often you take your medications. So based on the recommendations of that state-of-the-art review that recommended ways to substantially reduce non-adherence, Dose identifies monitoring methods, it improves the evidence base. Once providers like me can see patients' medication adherence, I'm better able to make decisions on which medications might work better for your blood pressure, your heart failure, or any other medical condition that you may have. And the beauty of this, because we're covered by Medicaid waiver programs, we're alleviating health disparities by making this technology accessible to everybody. So what does the future look like? And I want to wrap things up by peering into a crystal ball in an attempt to see a future. And I see a clinic, and maybe it's a physical building, maybe it's just a room within an existing clinic, maybe it's not a room at all, maybe it's just this virtual clinic database. And this clinic will teach patients how to use these devices and collect actionable data from a pill box, safe but effective shock therapy, blood pressure monitors, Apple Watch, Lumen, Oura, smart scales, Whoop, and even blood sugar, continuous glucose monitors, to understand what this data is and how it can lead to better patient outcomes. And maybe this is some wild fantasy, but I really doubt it, because all of these devices and all of its data will lead to better, more individualized care for our patients with truly actionable data that I can use as a provider. And if we don't get involved as physicians, which is exactly what I'm doing here, I'm afraid that we'll be left behind. And not only do these devices have the potential to impact the lives of our patients, but also our own personal lives as providers. So together, we as physicians and all of those in healthcare, together with industry, can actually make this future a reality and lead to better outcomes for our patients and for ourselves. Thank you.
All right. Well, thank you to Dr. Jensen for your time and expertise during today's On the Pulse session. A fantastic presentation as always. And hello, everyone. My name is John Rickert, and I'm the virtual event lead here at the Minneapolis Heart Institute Foundation. Just going to jump on here to help facilitate the Q&A portion of today's event. So the questions that we have prepared today all came through via registration. So thank you to our registrants who did submit a question during the registration process. However, please also feel free to add additional questions using the Q&A pod, which is located at the bottom of your Zoom screen. These questions may be discussed in future On the Pulse sessions. So the first question that we have, Dr. Jensen, comes from an attendee who asks, if you could pick one wearable device to recommend to attendees, what would it be and why?
That's an excellent question. And before I jump in, I also wanted to point out that all of these devices and all of this data changes so quickly that it's impossible to stay up to date. And so I actually created this email address today before the presentation, because I plan on putting together a monthly newsletter for those that are interested in these digital health technologies that I'll plan to publish probably once a month to start, but would love any input from anybody here in the audience today as to what they'd be interested in and any subscriptions that they'd like to sign up for. So if you send an email to digitalhealthmd@gmail.com, I'll for sure get back to you. And if there's enough interest, I'll absolutely go forward with this newsletter idea. But to move into one device, that's really hard. But yeah, I think the device that universally impacts everybody is Lumen. And that might kind of surprise people because activity monitors are kind of the more mainstream device, but Lumen is such a crucial tool and a device that I use daily to understand where my metabolism is, what I should be eating on a daily basis, And it provides really good actionable data and a lot of excellent dietary information. And what I've learned is that all of this data runs together, where if I have a night of poor sleep, and I'm really active the day before, my lumen score, my metabolism actually changes. And so all of that is to say, a daily lumen measurement in the morning to measure your metabolism, I think, is the most effective tool for people to use on a daily basis.
That's fantastic. Thank you very much for that response. So the next question that we have, it comes from an attendee who asks, what wearable device or devices do you own and wear and use on a
Yes.
daily basis?
So Lumen, as I mentioned, is one. I've gone through most of these devices that I've talked about. I used Oura for a while. I used Whoop for a while, especially over COVID after I saw the entire scenario play out with the PGA Tour. And those devices, I also have a sleep number bed to track the sleep too. What I use now is Lumen every morning. I use my Apple Watch at night, not just for the sleep tracking, but also because if I'm on call from home, I use that as my pager to not disrupt my wife's sleep, and the sleep number bed. So I can actually compare, and it's pretty interesting how different devices. My wife uses Oura every day. She has that ring on all the time, and comparing devices with Oura and Sleep Number to get pretty similar data. There are some differences, and again, there are some devices I trust more for certain things than others. But for me, Lumen, Apple Watch for sleep, and Sleep Number bed, which I don't have to think about at all. I lay down and it starts tracking the data.
Yeah, absolutely. Appreciate the insight. So our next question has to do with insurance. So I totally understand if this is not in your wheelhouse here, but do you have any insight as to insurance coverage for a wearable device?
Yes, and unfortunately, it is not prevalent at this point. The one device that you can use your flexible spending or health savings account, FSA and HSA money, is for the AliveCore cardio device, and that's outlined on their website. But this question does come up a lot, and I actually just looked into it again today. But from a wearable standpoint, otherwise, the Apple Watch, the Fitbit, Oura, to my knowledge, are not covered by any sort of insurance at this point, unfortunately. And it's because they're not designed as medical devices. They're, of course, tracking data. I think there's a good possibility that changes someday, but for now, those devices are not covered.
Yeah, completely understand. And I think it'd be fair to say for our attendees who are wondering to reach out to your insurance provider for further clarification there.
Absolutely.
So you had mentioned that you use a sleep number bed, a smart sleep number bed. I actually do as well. And this attendee asks, he says he likes the idea of being able to track sleep and exercise patterns, but worries about privacy concerns.
Sure.
So do different device manufacturers share information differently?
Yeah, that's a great question, and an important concern these days. I think it's really important that each device handles that differently, and to make sure you're going in eyes wide open with how your data is shared. There's a setup process with all of these devices, with Oura, with Apple, whether you want to share your data, whether you don't. But I think overall, with data like this, these companies are aggregating it on a population level. So even thinking about that study done by the New England Journal of Medicine, which was, of course, done with everybody's permission, but they were looking at 400,000 people and tracking whether or not atrial fibrillation or irregular pulse notifications were showing up. So it's not so much about the individual. That individual data really is only pertinent to you and your physician and your care provider, not really used on an individual basis by the companies. But I understand that concern. And so I think depending on your level of concern, it's important to read through those individual devices' privacy statements, which can be long, super long, but important to you, important if you do have a high degree of concern.
Yeah, absolutely. Appreciate the insight. And to your point, sometimes those terms of service documents are quite long and can be arduous to get through. Sorry, go ahead.
I was going to say, just at the end of the day, I just pull up my phone and this thing is tracking me, everything I do, everywhere I go. My car is tracking me, everything I do, everywhere I go. So I think I understand the hesitance, but I also understand that it's pretty pretty pervasive throughout all of our lives at this point.
Absolutely. Absolutely. So we've talked about a lot of the positive aspects about wearable medical devices, but let's talk a little bit about potential negative aspects of these devices. So this question comes from an attendee who asks, is it possible for wearable devices that monitor specifically heart rate to have a negative impact on users? They go on to give an example of accuracy problems or potentially causing unnecessary worry. Is that something that you see in practice?
Yeah, absolutely. And with any sort of diagnostic device, people often forget that it's not a binary yes or no. There's degrees of error within every single test that we do in medicine, and it's really important for us as providers to keep that in mind. For the people that are using these devices and are not as familiar with the fact that these diagnostic devices can have error in them, it can be a little bit alarming at times. But I think the takeaway point for sure, number one, is when you get these notifications, it is important to talk to your physician, call your physician's nurse or anybody else on the care team to talk about this in more detail. On the flip side, for me as a provider, that actually presents a serious concern in that we are not set up right now to handle all of these devices and all of the data, not just from an accuracy standpoint, but from a volume standpoint, where we don't have clinics at this point that are set up to appropriately address all of these concerns in patient care. So it's a really big problem that we're working to solve. And I think, again, I encourage all of my colleagues in medicine to get involved on the front lines of this so we can build the infrastructure necessary to address these questions and concerns that are going to come in from these devices. But remember that what we're talking about now are not medical devices. While they can aid in the diagnosis of certain things like atrial fibrillation, they still are not accepted as the gold standard. So further medical diagnostic interventions and management plans need to be done under the care of a physician or an advanced practice provider.
Yeah, great point, and totally makes sense. So another potentially negative, side effect of these devices, is there any potential or any research that you are aware of where a wearable device could potentially interfere with a different medical device? So for example, and this is just an example, but an iWatch interfering with a pacemaker?
Yeah, that's also an excellent concern. And before I even answer that question, again, I'll point to the new iPhones with their magnetic backs, and that there were articles that came out a year or two ago now, where that magnet on the back of the phone that allows it to stick to the wireless chargers actually did interfere with people's pacemakers and ICDs. And so the recommendation is to not carry it in a left shirt pocket because of those concerns. And to answer the question of interfering with the devices, none of these devices would interfere with a pacemaker or an ICD. At the same time, they can be limited in the interpretation of data for patients that are paced with pacemakers all the time. An ICD wouldn't interfere with monitoring a patient's heart rhythm or heart rate, but pacemakers can interfere with devices like AliveCore, which are measuring the rhythm and what the electrical signals look like. So the devices won't harm the pacemaker or the defibrillator, but the defibrillator or pacemaker could interfere with interpretation of the results from these devices. Yeah. Most of them are going to be completely safe and interpretable.
Yeah. Absolutely. Well, appreciate the insight there. So let's do a couple more. I know we're coming up on time here, and I appreciate your time today, Dr. Jensen. So this attendee is asking, are wearable devices something that a physician typically would prescribe to a patient?
Not necessarily prescribe. I guess that isn't quite the right word. I would say recommend for sure. There are patients who have palpitations intermittently, for instance, that I find these devices really helpful in figuring out what's going on. We have different medical grade devices like patches that you can wear for 2 weeks that track your heart rhythm, but some people don't have the palpitations in a 2-week period. Sometimes it's every 6 months, sometimes it's less than that. And while we have different medical devices that can address this, things like AliveCore and Apple Watch can actually track this over a longer period of time, where when you feel these symptoms, you have the device in your pocket if it's an Alive Core, or on your wrist as an Apple Watch. You take a quick EKG, and then we at least have something to look at and talk about from a provider standpoint. So I've recommended it there. I also recommend the basic utilities of these devices in measuring exactly what we've talked about: activity, sleep, really basic things that all of these activity trackers do, because I have a hard time remembering what I ate for breakfast 2 days ago. So for me to sit in a physician's office and say, oh yeah, I've been really active over the last 6 months, what does that actually mean? But if you show me when you're sitting in my office what your activity levels have been, how your sleep has looked, what your heart rate and heart rate variability have looked like, that longitudinal data is really helpful for me to understand your baseline activity level, and then adjusting medications or talking about other strategies accordingly. So that data, especially over the long term, is really helpful. So I absolutely recommend patients who are interested to pursue these devices.
Absolutely. We'll appreciate the insight there. And, the big benefit is that it's tracking your data essentially continuously, or as long as you have that device, activated, so to speak. So let's do a couple more here. So this attendee asks, what excites you most about the future of this industry or the research surrounding it? And where do you see the most potential in the wearable device market?
I think one of the most exciting things for me, and I alluded to it when we talked about using the devices and their data to come up with individual risk predictions. We have really good models right now with a 10-year cardiovascular disease risk or coronary artery calcium, a heart scan. That's another PSA for patients really over 50 who are concerned about their risk of heart disease. Take a look at Heart Scan. It's a $100 test that looks at coronary artery calcium in the blood vessels of your heart. And we have really good risk models looking at that coronary artery calcium. But I think all of those are population based. But if we're able to actually use your own individual data in the setting of a population, but understanding yours individually, hopefully will allow us as physicians to better target those at high risk. That's the whole point of any intervention, especially in prevention, is stratifying people based on low, medium, and high risk, and then being able to offer interventions that ultimately it's tough in prevention because these interventions lead to no outcome, which is a little bit harder to measure, but in my mind, the most important metric to measure. So to boil it down, individual risk prediction is something that I get most excited about. And then all of these, squishy things that we as physicians recommend, these healthy lifestyle, this healthy diet. Well, what does that mean? I get excited now that these are devices that are looking to answer those questions in a way that takes the burden off of us as physicians, but makes it all the more important for people like me, my colleagues, to get involved in this and to understand the data that's coming out.
So as the prevalence of artificial intelligence continues to rise, essentially, do you see artificial intelligence playing any sort of role in these types of devices, or does artificial intelligence already play a role in this area?
Yeah, there have been papers already published about the Apple Watch and its algorithms of identifying atrial fibrillation, and they talk about this deep machine learning that can happen with more and more data. These prediction algorithms and diagnostic tools become more and more accurate. So I would say artificial intelligence is very much already used in the development of these algorithms for the diagnostic purpose. And I think will become even more prevalent as we're able to pool larger and larger amounts of data at the population level. But then again, having access to the individual's data is key.
Yeah, that's just absolutely fascinating. And thank you again so much for your time today,
Yeah.
Dr. Jensen. So is there any final words that you would like to share or say to our audience today before we sign off?
Absolutely. I think all of this is super exciting and again, changes by the minute. So I would love to hear from anyone and everyone who's interested in this topic. Send me an email, Digital Health MD. I will respond personally, at least to start. But if there is enough interest, I would love to start writing a monthly newsletter just to keep people up to date on the happenings in this rapidly evolving field, but also kind of responding to the questions and the needs of patients and people out in the community. So it would very much be a conversational and collaborative venture. And so if anybody's interested, please send the email digitalhealthmd@gmail.com. Would love to hear from everybody.
Yeah, absolutely. That sounds like a fantastic idea. So, that's all the time that we have for today, folks. So a big thank you again to Dr. Jensen for presenting on this excellent topic. And thank you to all of our attendees who joined us this afternoon. We appreciate your participation. Real quick before we sign off, I just wanted to mention that we do have an upcoming On the Pulse session, which is scheduled for Wednesday, April 26th. And this is going to feature a joint presentation from Doctors Emmanuel Berlakis and Vinny Bapat presenting on life after CABG, CABG standing for coronary artery bypass graft. So I'm going to go ahead and add a link to the chat pod now, which you may use to register, and we hope to see you there. And thank you to everyone, and have a great rest of your day.